amigos, bienvenidos a tu programa Unidos contra el COVID-19. El día de hoy tenemos al conocido y reconocido abogado Paul Samaco con nosotros. Hola Paul, ¿cómo estás?
Estoy bien, gracias.
Well, we're very happy to have you here today. It's so important that you're here showing your support for the Latinx community, and you've been an ongoing advocate and you have very active presence in our community. So thank you once again for being here today.
This is a mission from my heart, sincerely. I enjoy not only what I do every day as a lawyer, but I enjoy taking my time and my effort and my energy to help people. This is a true labor of love, and anything I can do, I'm all for it.
Thank you. And as you know, this program is about COVID-19. We talk about myths, we talk about solutions, we talk about concerns from the community. You run a business. You have a business, you have admin staff, you have attorneys that you work with, and you see clients on a daily basis. Tell us a little bit about the struggles that you encountered during the pandemic and how your business changed. What kind of changes you had to adapt to?
Claudia, this has been, like everybody else, something that's new for me and trying to make sure that everybody is safe. At the very beginning, I admit I was not convinced this was a big deal, but very soon you have to realize, yes, there's more and more people in the hospital, more and more people are getting sick. You're hearing stories from every part of the community. We immediately put up a sign on the door that you cannot come in until you have on a mask. And I made everybody in my office put up a mask. And we made sure that we were always 6 feet away from each other. As a matter of fact, for maybe 2 months in my offices, I only had half the people coming in. So I would have somebody come in Monday and Tuesday and half the day Wednesday, and then the other group come in Wednesday afternoon and Thursday and Friday. And as time went by, you know, I came into the world of technology where everything became remote. Mm-hmm. So we work with clients on the phone. We work with programs where you can sign papers through your computer on a computer program. We started using on the Apple phone the FaceTime. We started working like 95% of the world on Zoom. And you know, it just became more and more clear that this pandemic is real. It's horrible. It's devastating. And with each new learning and new understanding, I'd like to think that I increased safety protocols between my staff, myself, visitors to the office, clients. We started using delivery services that would pick up the package outside of the door or leave the package outside of the door. I mean, you do what you think you can. Health is the most important thing. When the government approved the vaccines, I think I was maybe one of the first in line. I made all of my staff get vaccines, and every one of them agreed it was necessary. There is a lot of conversation about whether you can require it, or it's the mandate, or you know, what employment can do, and can you hire somebody or fire somebody? You know, if they, you know, do you have to hire somebody? Can you use whether or not they've been mandated, whether or not they've been vaccinated, excuse me, or if somebody doesn't want to get a vaccine and they're working for you, can you fire them? So there's all types of legal questions. And I just made up my mind, you know, if you're not vaccinated, you're not coming to work, period. And if you're not coming to work for more than a couple of days, you're not working for me, you lost a job. And I'd worry about the legal concerns later. I mean, that's how concerned I was, and I think I'm very lucky because every single person that works for me agreed with me that getting the vaccine was very, very important. And now, you know, they have the vaccine for children. Frankly, you know, I mean, I don't want to upset anybody, but I just don't understand why you wouldn't get a vaccine. The excuses are, in my opinion, I think they're ridiculous. You know, if you have a medical reason, okay. A religious reason, I guess. But many people with religious reasons, they've gotten vaccines for polio. They've gotten vaccines for other diseases and concerns. So I'm, you know, maybe in a group of people that will alienate other people. I mean, I don't go on TV and start screaming that you have to get a vaccine, but I definitely support it. You know, I've gotten all of mine and the booster, and everybody works for me, and my whole family, and most of the friends that I have. And there was one doctor that told me that he doesn't believe in it. And I said, okay, I guess that's your right. But I'm not making recommendations to any of my clients to go and see him. So it's a very difficult time in our world. And I think, you know, if you don't have your health, all the rest of it doesn't matter.
Yeah, and you did what you had to do to protect your staff, yourself, and your community. So thank you for that. Now, you have clients on a daily basis, and I'm sure you heard a lot of the feedback and the opposition with this vaccine. Can you share some of that feedback that you heard from your clients and maybe your staff members?
Not from my staff. Again, I think I'm very lucky. I have a group of people who have the same belief that I do about health first. And you know, some of the people who have come in, the clients, we make them wear a mask. And sometimes they'll come in and the mask is below their nose. And I say, excuse me, you know, I don't want you to be upset with me, but you have to put your mask above your nose. And sometimes they look at me like I'm crazy. And my response to them is, well, thank you, after they do it. I am not going to start having an argument with somebody. But the excuses that I heard are, it's a personal choice. Okay, you know, but are you going to stay in your room in your house and close the door until all this is over? Because it's not personal. I affect you, you affect me, you affect him, she affects her. It's not a personal choice. We live in a world where we interact socially and with business, you know, with people, and you can't just decide that it's just me, I'm going to do what I want. That's just not, that's not civilization. That's not getting along with your neighbor. You know, I've heard people, I don't know if it's safe. Well, okay. There are people who have been vaccinated and they've had COVID. But I think the effects, I know the effects are less than if they didn't get the vaccine. They don't want to get the vaccine because they don't know if it's safe. Well, we have lived and seen other vaccines throughout history. Did those people know it was safe? But most of the people that got the vaccine survived. Well, I mean, this wasn't just some invention of the crazy scientist who lives in the mountains and came down and said, okay, this is the great serum to cure everybody. That's not what it was. This was tested thoroughly, and results have been proven over and over and over and over again. So the time for waiting to see if it's safe has long passed. It's possible you could have a bad reaction. If it happens to you, gee, that's very sad, that's unfortunate. But that's not a reason. You know, if 99 people are safe and one person, you know, gets a little sick or even dies, I'd rather have the 99 people safe than expose a full 100 people. And maybe that's terrible. Maybe if I was that 100 person, or my wife or my daughter or my child was that 100 person, maybe I'd have a different opinion. But I've thought about that. I don't think I would. I would still have the same opinion.
And the data shows it. You know, people now with the new variant, people that are not vaccinated have really bad results, outcomes with this new variant versus the people that have been vaccinated.
That's correct.
It's right there and it's accessible to everybody.
Right.
So the decision is not that difficult. You can't really balance the two. There's not really, it's not proportionate.
It's not.
It's not at all. So thank you for sharing that. And you started a lot of campaigns for different things, Paul. You're so involved in that community, and that's why we wanted to invite you here today.
Thank you.
Because although you don't speak Spanish very well, although you do say a few words here and there, yes, a few words. He understands just enough, right, to get by. But you're very, very deep involved in the Latinx community. You've done campaigns for Textarudos, so don't text and drive, and having your seatbelts, etc. Tell us a little bit about that and how that started. And that has been also part of the equity clinics. We've done a lot of vaccination clinics throughout the different neighborhoods, and we invited Textarudo to be part of that initiative. So tell us a little bit about that.
And I wake up in the morning, I shave sometimes, I come to work, and my goal is to do one good thing. It has nothing to do with money. I think if you're a good person, if you are honest with people, if you help people, if you do a good thing, the money, it will take care of itself. I've been very fortunate. I have enough money I can buy food tomorrow. I still have a roof over my head. So what is one good thing? How can I do that? So I've tried many things. Some have been disasters, complete failures. The one I'm very proud, you mentioned Textarudo. So I have a campaign, don't text and drive. The character, we have a costume, one of my employees wears it. We go places to festivals and now to these clinics where at the clinics, the little children have seen him on TV and now they're put at ease, and now when they're gonna get their injection, their shot, now they're a little more comfortable. You know, on the big picture, big deal. So one little kid was more comfortable getting his vaccination. But for that little kid, at the end of that day, I did one good thing. And maybe I did 10 good things. And maybe if there were 100 children at that clinic, I did 100 good things. I've had people come to me at the festivals that we used to have in the summers, you know, Hispanic Heritage Month and all the different communities, Peru, Bolivia, Salvador, they all have these big festivals, as you know. I've had people come to me and tell me stories that their children who are driving, they know they were never putting down the phone in the car. But then they saw my commercial with Textarudo and now they get it and they're not going to do that anymore. Maybe I saved one life and I never know what will happen, but that's one more person not doing that dangerous activity. You know, we had commercials putting on the seat belt, putting the child in the child safety seat. So if I do one good thing, just every day, one good thing, I think that's okay. I can be happy with that and know that I led a good life. I'm not trying to be man of the year. I don't want any awards. Just personally, you know, I mean, if later we get up and you're carrying groceries, I'm gonna hold the door for you. Just one good thing, that's all. Do I get an award or grocery or you know, applause for that? No, but it's, if you're not helping, why are you out there? What are you doing? Everything can't be me, 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 me. It has to be me helping you.
Exactly.
Yeah,
and,
so.
On behalf of the Latinx community, I want to thank you for that, Paul, because you're not saving one life, you're saving tons of lives.
Well, I hope so.
Yes, and thank you so much for your dedication and for advocating for us. We are so grateful to have you in our community, and thank you for being here today.
Like I said at the beginning, this is an honor. If one person watches this and decides I didn't get the vaccine yet, Paul Samico said, good idea, and they go out and get it, thank you. Good.
Yes, thank you. And Paul Samico says, get your vaccine. Thank you, Paul.
Okay, great.
Muchas gracias por estar con nosotros. Ahora regresamos aquí en Unidos contra el COVID-19.